The joy of knowing that I can just vibe with my family and friends non-stop on Sundays. Yeah. Sundays are that special on MTN. With as low as 65 pesos, enjoy endless conversations with non-stop talking and texting on all networks. Make this and every other Sunday extra special. Just dial star 550 hash for this amazing offer on MTN. Terms and conditions apply. It's a Wednesday and we get to speak to the drive doctor, the award-winning drive doctor. Yeah. Thanks to Dr. Yao Osafo, this show won the radio program of the year. So welcome the award-winning doctor, Dr. Yao Osafo. Number 7 Presec on that year plus radio program of the year. Turn off his microphone for me now. Turn it up. Doc.
Yeah.
Welcome. Congratulations to you, Doc.
Thank you.
Charlie,
Congratulations to you as well.
You've won radio program of the year.
Wow.
How do you feel about it?
I saw the plaque and I was like, wow.
This
man.
is beautiful. Is it a trap picture near the Bomb Medical Hospital? You understand? We have to take a picture, and
we know we have 2 billboards. Why men sat down on the cave. Yes, the boss. There's 1 billboard in front of the hospital. They will put one there. The way you enter.
Oh my God. Oh, Charlie, really good to see you.
Congratulations to the entire team.
Yes.
It's been good. And Kwame, it's been a fantastic week.
It has, man.
There's so many. I don't know even where to start from. Last week by this time, where were you?
Oh my God, I was in Kumasi, sitting in the great hall of KNUST, looking at the Blue Magicians, the Presecants on the stage, showing Prempeh College and Adisado how to solve math questions,
levels,
and science questions.
Well, next to us in Mampo, there's a certain school.
Which one?
Where they teach sign language.
Yeah.
Prempeh 4, they have to come there. They're around 5. They wanted to do sign language. So this one I'm paying for them.
They should come.
It's near me. They will teach them sign language there. But I mean, come some here 3 times. Final 3 times.
No,
but in my batch 96. We lost to Prempeh in the final.
Oh, really? In 1996?
1996.
Wow.
At that time, it was Southern Sector, Northern Sector.
Oh, right.
So we were Southern Sector champions.
And they were Northern Sector
Sector champions. So we thought we were just going to carry the thing.
Oh!
No,
the show with Pepe.
Then last year.
Oh, boy.
It was the 25th anniversary for our group.
For your group as well.
And the day before was the speech day.
The Prempeh boys have invaded the studio. They're coming to turn off the microphone.
What do you want here?
I don't understand what do you want here. I mean, can we get security?
The whole place is even
the Prempeh guys in the building are threatening our lives.
Fabian man is sitting. Also, yes, sign language. He's also doing sign language like around 5. Please.
No,
could you wait for us?
If you want microphone, win. If you want to talk, win. We'll give you microphone.
And then come.
Do your health and go home.
I think we should do our health and go.
So it was great that we were able to get it. And then when we welcomed the boys home,
absolutely,
on Friday, I mean the whole campus erupted.
Charlie was something else. Boy,
mini bonfire
with a big jam,
fireworks, big jam.
Yeah,
congratulations to all the boys, all of them.
Yeah,
and Prempeh, Adisco, all of them. I mean, getting into the final is such a big deal.
Absolutely,
and your young boys. They're 15, 16, 17 to go on stage to do what they do. I mean, we sit at the background and then we do the bragging.
Yeah.
Then there was the CIMG Awards as well.
Absolutely.
The big one. Time. Kwame, congratulations. The entire team.
Yeah.
Backroom staff. Wonderful. Then on Saturday, something special also happened. My younger sister, Dr. Adobia Obisi.
Okay.
graduated from the medical school and was inducted by the Medical and Dental Council.
Oh, wow.
Yeah, so we have a fresh
There's
doctor.
a fresh doctor in the house.
Yes,
Yo.
so School of Medicine, KNUST graduates, Dr.
Oh,
Adobe
Charlie.
Say, congratulations. I mean, it's a very tough journey to embark on, but now she has the world at her feet.
Wasn't she the one I saw at the
Yes,
at the site
met
the other day?
at the site the other day. She's the one. Yes.
Oh, congratulations
I
to
that
her.
You guys met.
Yeah, I met her.
So formally, she was inducted last Saturday by the Medical and Dental Council.
So now when I come to Medicals, I have to see her. She has to
now
take care of me.
I'll pass you on to
hand me over to her.
Kwame, now let's talk about health. Since
yes.
Gwegwe Super wants us to talk about health, let's talk about health.
We started the conversation about breast cancer a couple weeks ago.
Yes.
And you've given us a lot of information. Today we can wrap it up nicely, and I would want our listeners to call in, have a little open clinic about breast cancer. So if you're listening in and you have any questions at all, you have any issues you want clarity on in regards to breast cancer, we're actually wrapping it up. Of course, the month of October was the Breast Cancer Awareness Month. So we spent time talking about breast cancer. But if you have any questions, or the doctor's here, just give us a call on 0302-216-541. Or you can send us a WhatsApp message on 055-1111-997.
Right. So, Kwame, let's start with some of the signs and symptoms of breast cancer. I would say that pain and discomfort are typically not present in the early stages of the disease. So, contrary to what most people know or think about breast cancer, pain is not a feature in the early stages of the disease. Unfortunately, that is the biggest drawback in terms of getting people to come in. Because when you look at the health-seeking habits of the Ghanaian, most of the time it is, if it's painful, then I go and get medical consultation. If it's painless, more often than not, you wouldn't see the Ghanaian in the hospital. So this is one of the things I need to really emphasize, that pain and discomfort are typically not present in the early stages of the disease. So what are you likely to find? Number one, you may find a painless swelling in the breast, which is a very common early presentation. Typically, we would say divide the breast into four quadrants. You draw, you put an imaginary vertical line through the nipple, and then a horizontal line as well through the nipple, and you'd come up with four quadrants. The upper outer quadrant, it's usually the commonest site that most people find lumps. We're not exactly sure why, but a painless swelling in the breast is the most common early presentation. Number two, you may find a blood-stained nipple discharge. So, except a woman is breastfeeding, we don't expect even the adult female to have any nipple discharge. Sometimes you may have a milky discharge when you're not pregnant or you're not breastfeeding. We'll call that galactorrhea, and that is also a different entity. If the discharge is milky, a yellow-white discharge. But if you have a black, brown, or bright red bleeding, then that is a blood-stained nipple discharge. You should go and see your doctor immediately, because that may be one of the early symptoms of breast cancer. Number three, recent nipple retraction. So the nipples are supposed to be pointing outwards. Whether, if it's a younger woman, then, they point to whoever it is in front of you. It points outward. It can also be pointing downwards, but it should still be pointing outwards. Anytime the nipple retracts, feels like it's going back inwards, then that may be a sign. If that is not what your nipple has been like since you started breast development, then you should want to talk to your doctor about it. A change in the size and shape of the breast is also something very important. So when I get to talk about the examination, we'll talk about the inspection. So we've got a pair of breasts, but Kwame, they are not exactly the same. Most men wouldn't know because we go ballistic when but the women would know that they are not exactly the same. The men think that they are all the same, but they're not exactly the same. But if there is a significant change in the symmetry of the breast, then you should want to talk to your doctor about it. Number 5, a rash. If you notice any rash on the breast, particularly the dark skin around the nipple area, or you find what we call dimpling, skin dimpling, and if you squeeze an orange, not the one that we've sort of like peeled off. No, you get this dimpling sign. If you begin to see that on the skin of your breast, you should talk to your doctor about it. Number 6, if you find a lump in your armpit, that is also an indication for a thorough breast examination by a clinician. Why the armpit? Well, Kwame, the tail of the breast is in the armpit. So the bulk of the breast you see on the anterior chest wall, but it goes all the way into the armpit. That's what we call the tail of the breast. So you've got actually breast tissue in your armpit. And that is always one place that you should examine to complete any breast examination. So ladies, please, during the examination, make sure you check that particular area as well. Number 7, that is when you have advanced breast cancer where it has moved to different parts of the body. Then the individual may have this intractable cough, bone pain, everywhere hurts, weight loss, abdominal distension, and so on and so forth. So that is for very, very late disease. So the first 6 are some of the early signs and symptoms that you may notice, or a woman may notice, usually very, very painless. Very painless. So I need to emphasize this particular point, that it is painless in the initial stages. And therefore, we should not wait for pain to decide to get a doctor to get a clinical or a professional opinion.
Okay. The number to call is 0302216541, or you can send us a WhatsApp message on 05511119997.
Right. So Kwame, let's move on and let me talk about the early detection and also the sequence for breast examination. Okay. Actually very simple, and we will teach what we call the self-examination, and then the doctors will perform the clinical examination of the breast. So every woman should do what we call a monthly breast examination after the age of 20. So if you look at the prevalence of breast cancer, then that is a recommendation. Of course, every now and then you get a very rare incidence of breast cancer below the age of 20. But we would recommend monthly breast examination from the age of 20. For premenopausal women or women in the reproductive age group, then we would say that you should pick a day, a particular day every month. And this should be between day 5 and 7 after your menstrual cycle.
Okay.
5 to 7 days after you've completed your menses. So you can pick day 5 after your menses, you can pick day 6 after your menses, or you can pick day 7 after your menses. During the menstrual cycle, there are changes in hormonal levels, and we believe that the breast becomes a bit more difficult to examine. There are changes that happen during the menstrual phase, the phase that you are bleeding. So for it to get as close as possible to what it normally would be, we would say 5 to 7 days after your menses. For women who are beyond the menopause, or menopausal women, meaning they've stopped menstruating, then you should do this on a specific day of the month. You should just pick any day in a month and say, okay, on the 12th of every month, I'll examine my breast, and then you keep it at that. Because there are not going to be any hormonal swings with accompanying changes in the breast tissue. Right. It's a very simple sequence. Look, feel, and squeeze. Look, feel, and squeeze. So, Kwame, that is what the 3 steps involve. So, we would advise the woman to stand in front of the bathroom mirror or her bedroom mirror. Obviously, you need to expose your entire chest to see both breasts. You've got a pair, so the first thing you are looking for is symmetry. So you stand in front of the mirror with your hands on your waist, the bone, that's called the waist, the iliac bone or crest. Or you can clasp both hands above your head. Either position works. All these positions will help for you to correctly assess symmetry, the size of the breast.
Yeah.
Then you're looking. If they are all equal, you look at the skin. What are you looking for? You're looking for a rash. You're looking for puckering. You're looking for dimpling of the skin. Every woman should know the normal skin coloration of the breast. And if you find anything on the breast that you think it's unusual, then you should alert us. Because the breasts tend to droop at a certain age, or if they are of a certain size, most women tend to miss the under parts of their breast. So if you have to lift it gently, lift it, and maybe you can use a small mirror to be able to look at that aspect of it. So that's for looking. Sorry, again, the nipple must be pointing outwards and not be pointing inwards. The second step is you feel. When you are feeling for a lump, so the lump is a firm, most of the time well-defined, or you can have an ill-defined mass that is in the substance of the breast. Again, we would want you to go in a very sequential manner. The most sensitive part of your palm are the finger towards the fingertips. All right. So, Kwame, the 4 quadrants I talked about: an imaginary vertical line through the nipple, another imaginary horizontal line through the nipple gives you 4 quadrants, and then you start from 1, and then you work your way anti-clockwise until you come back to the same point. Once you've done that, you'd realize that there's a central portion, which is the nipple, and then the dark skin around it, the areola, and then you go around in, again, an anti-clockwise manner. If you find a lump, just get a marker, a pen, or something, and then indicate where you felt the lump. This is very important because your doctor, you may want to show it to your doctor and say, this is exactly where I felt the lump. Right. Once you have done that, you should also then go into your armpits. Kwame, at this point, you may lie down and you may put the hand on the part, the breast that you examine. So if you examine the left breast, the left hand goes behind your head so that you have easy access to your armpit on that side. And then you examine the armpit on that side as well.
Okay.
And again, you are looking for a lump. Typically, it is painless. If you find a lump, don't worry. Go and see your doctor about it. There are so many other conditions that can cause one to develop lumps in the breast. Indeed, today, I had a patient who came in, and the lump turned out to be a benign lump, a fibroadenoma, and not necessarily breast cancer. But let that be the judgment of a doctor. So if you find a lump, just indicate where you found it and then get your doctor to examine. Then the last step is the squeeze. So we look, we feel, and then we squeeze. You're going to grab the nipple gently between the thumb and then the index finger, and then you squeeze it. You try and grab a bit of the dark area around the nipple, the areola, and then you come all the way up towards the tip of the nipple. So you get a bit of the duct in there, trying to see whether or not you would find a discharge. I would always advise that you get a piece of white tissue over the nipple. Just in case there's a discharge, you are able to tell us the color against the white background. So, Kwame, there you go. Look, feel, and squeeze.
Okay.
And these are the steps.
All right, that's really good information. We've got questions coming in on our WhatsApp platform. You can also send us a WhatsApp message on 055-1111-997, okay? Or call us, if you will, on 0302-216-541, okay? Now, one of our friends says, but what if there's a lump in the armpit, but ultrasound indicates that it's a breathing issue? It's a breathing tissue, actually.
Not quite sure about the diagnosis she puts at the end, a breathing tissue. Well, so there are different lumps that you can find in the armpit.
Oh, okay,
Right.
okay. So I think it's a typo.
Okay.
So
All right.
it says benign tissue.
It's a benign tissue, exactly. Right. So it's a benign tissue. Right. So you see, she took the step, found a lump, went to the hospital. A doctor probably examined, then requested for an ultrasound scan, which was one of the modalities for investigating that lump. We may go a step further and actually biopsy it. When we say a biopsy, it means surgically we remove a part of what we find suspicious and then send it over to a pathologist, a histopathologist, to give us a definitive diagnosis, because then they have the tissue, right? So it may be a lymph node, and it's only when you have examined the lymph node using different modalities available to us and you come to a definitive conclusion, then we would say we would have investigated it and we know what exactly it is. The lymph nodes are present. I mean, anytime you have a then you get a lump in your groin area. So lymph nodes are centers where you produce a lot of white blood cells that fight infection. So it could be that you have a lymph node in your armpit and it's not necessarily originating from breast cancer. But the most important thing is that if you find a lump, come in, let us check it out, and let's tell you it's benign.
I think you mentioned this, but it still asked anyway. Does having small spots like pimple around the nipple also an indication?
Right. So, Kwame, this is we've seen a patient who presented very late, and all she told us was that, oh, doctor, I started a pimple. You know, that later on, you know, sometimes people like to squeeze pimples and all of that. So we don't make any assumptions, especially when it comes to skin conditions of the breast. You may think it's pimple, acne, you know, but get a doctor to really look at it and take a proper history, thorough examination, and let that be the opinion of your doctor.
Okay. Thus, well, for the purpose of this conversation, let me use feasting of the breast by men really prevent breast cancer, and what's the science behind it?
No, it doesn't. It's a myth, and it's one of those things that it's not true. Scientifically, there is no evidence to back it up. We do not believe that those genetic mutations that actually happen in the genes, you know, and last 2 weeks, I think I mentioned the genes, the BRCA1, BRCA2, and then the PALB gene that are responsible now for breast cancer. There are mutations that happen in these genes that lead to the breast cancer. So it's not just having these genes, but you must have these abnormal changes that occur in the structure of the genes that leads to the development of breast cancer. And we don't believe that feasting, quote unquote, by men on the breast has any connection in terms of protecting you against any of those mutations.
Okay. All right. Let's get on the line now. Hello? Hello?
Hello.
Yeah, hi. How are you?
Hi, Lexis. My name is Na. So my question to Doug is that what if you're already suffering from prolactin? You know, those suffering from high prolactin.
Yes.
Have some discharges.
Mm-hmm.
So how do you know that it's not cancerous?
Right. So very important question I ask, and it's about the nipple discharge. You know, so if you squeeze the nipples or the nipple areolar complex and you notice a discharge, it is the nature of the discharge that would let your doctor swing one way or the other. If it is milky discharge, then it may probably be what Na is referring to. She mentioned a big word, prolactin. We call it hyperprolactinemia. High levels of the hormone prolactin, which is responsible for lactation in the body. Unfortunately, some women, although they are not pregnant, late pregnancy, although they are not breastfeeding, they have high levels of prolactin. And I happen to treat a few of them at the hormone clinic at Medicus. It's an entirely treatable condition. Sometimes we don't know why that happens. Sometimes it's just because of persistent stimulation of the nipple by even clothes, underwear, or men. That leads to hyperprolactinemia. So that's a totally different entity. I've given.
Did you have to add men to this? Do you have to add men to it?
Well, Kwame, which group of people would cause the persistent stimulation?
Babies. Babies also cause this. Why we? What did we do? What did men do?
You're only babies. You're okay. Men and babies.
Yo, we're here. We will take our time. We'll reduce it. Anyway.
Better.
But this is good. I wish we had time to take more calls, but we don't. So if you have more questions, I'd rather you reach out to Doc directly so he can help you with your concerns. So, Doc, if you can share your contact.
Right. So the number is 0501 477 340. 0501 477 340. And
right.
Kwame, they can still come in at the end of the month. We'll still carry on the free breast screening.
Oh, you're still doing the free screening?
We're still continuing with that.
Oh, that's
so
good.
Both
at Medina and
Mampong branch.
Okay, all right, great. Thank you. I'm grateful that you came by today, Doc. God bless you so much. Yeah. Dr. Yao Safo is the CEO of Medicas Hospital, Mampong, Ekapim, and Medina Firestone.